Hello everyone, how are you? I'm Dr. Shariful Halim, and today I'm here to talk about sickle cell anemia. I suppose you all have heard the name sickle cell anemia, and let's first start with a PBF or peripheral blood film of sickle cell anemia. Okay, so now here you can see a PBF, and in the center you can see something that looks like the moon in the past few days. So this is a sickle cell, and here you can see another sickle cell, close one, close one, close one. So a lot of sickle cells in that PBF, and let's just find out where is a normal cell. Okay, let's just find out. Okay. So this is a normal looking RBC, and this is a sickle cell. So actually now we really want to know what does happen to transform this normal RBC to this abnormally shaped RBC. Okay, so this should be our journey, okay, from here to here. Also notice that in sickle cell anemia you have some other type of cell other than sickle cell, such as target cell. So here is one target cell, looks like a target, another one, another nice one, okay, and some bizarre cells. Okay, let's just focus on the sickle cells only. Okay, next slide. So here is a pathogenesis of how the sickling occurs. So here you can see actually the sickle cell that we have seen previously. It is here is magnified and colored red, nice looking sickle. Okay, so it also looks like a banana. Okay, you can also say banana cell. I don't know if they permit you to say so. Okay, so this is a sickle cell, and let's start actually from the origin of the RBCs. As you all know, RBCs are developed inside the bone marrow from erythropoietic lineage and the stem cells. Okay, so the stem cells actually contain the DNA for synthesis of the globin portion of hemoglobin. Okay, so actually the hemoglobin in RBC, as you all know, it has two portions, the heme portion and the globin portion. So the globin portion is a protein, and this protein needs genetic code. First it is transcribed and then it's translated. So this is the genetic code, which is actually, we skip the process of transcription and we translated it actually to a protein product. So this is a normal, in the upper panel this is a normal patient with normal genetic code, and this is an abnormal patient with a mutation. So the basic cause of sickle cell anemia is a point mutation in the DNA, and the DNA that actually encodes the beta globin chain. So there is a point mutation, and this point mutation actually leads to a change of amino acid in the globin chain. So here we have a normal globin chain, and here we have an abnormal globin chain of hemoglobin S. Okay, so this globin chain has a lot of amino acids, as you can see. So it start counting 1 2 3 4 5 6. So the sixth position has a bold one. This is the glutamate, and in case of a beta chain of hemoglobin S or sickle cell anemia, you have valine instead of glutamate. So in case of sickle cell anemia, the hemoglobin molecule has an abnormal beta chain which has a valine instead of glutamate in position number 6. Okay, so this valine actually increases the stickiness of the hemoglobin molecule. As you know, normally hemoglobin molecules are present as a monomer, so they are not sticking together, they are moving freely, they are moving oxygens from your body and also carbon dioxide, and they are always monomers. But when you increase their stickiness by putting a valine in the beta chain, they start to actually arrange in a long polymer. Okay, so this doesn't happen normally, especially this happen actually when the patient has some stresses like dehydration or hypoxia or something like that. Those stresses actually increases the stickiness and causes the polymerization to occur at a very rapid rate, and this causes a very long polymer of hemoglobin, which actually the length of which is more than the total diameter of the RBC. So RBCs get stretched on both ends. So it was like this, and as it gets stretched in both ends, the both ends get actually spiky. So spiky ends due to the polymer. Okay, so this polymer, it can be seen here. Okay, so this is the polymer, and this polymer actually is represented on by the shadowed line. Okay, so this shadowed line represents this polymer, which actually distorted the shape of the RBC and caused them to sickling. So remember that sickling occurs mainly during periods of stress like dehydration and hypoxia. That's a very important thing to remember. Okay, let's go to the next slide. What does happen if we get actually sickling? What does it cause? Okay, so whenever a patient gets sickling, those RBCs, all of our RBCs move through the little capillaries they already do, and those little capillaries are sometimes smaller than RBCs. So RBCs actually have to squeeze through many of the RBCs, many of the capillaries. And whenever you have a distortion of the shape of the RBC, such as elongation and bending of the RBC, they actually start to clog up the blood vessel. So here you can see the blood vessel, and those are the normal RBCs and those are sickle RBCs, and sickle RBCs are actually clogging up the blood vessels, and this clogging actually will actually reduce the oxygen concentration, reduce the blood flow and reduce the oxygen concentration in the distal areas. So here this is a depiction that here you can see some red blood, and the blood actually is getting bluish down here. So there will be hypoxia, and hypoxia of any organ can occur depending on where is the clot formation happening. So if the clot formation occurs in the cerebral arteries, like in this patient, it will lead to headache. If the clot formation occurs in your chest, it will lead to acute chest syndrome, where there is chest pain and dyspnea. If the thrombosis occurs at other sites, such as in these babies, the clot formation occurred in peripheral veins and peripheral vessels, and this leads to swelling of the hands. So it's also called hand-foot syndrome or dactylitis. Okay, and sometimes there is something called painful bronchitis. This also occurs due to formation of clots in the blood vessels that supply bones. Okay, so those are the most common sites of obstruction. Okay, so what happens after obstruction and those symptoms? If RBC obstruct the vessel, it actually gets damaged itself also, because the blood is always moving, and it's always moving over the vessels, and there is actually friction between RBC and the vessel wall, and some multiple other factors leading to damage of the membrane. And also the hemoglobin that is altered, the hemoglobin that polymerizes, stretches the RBC. So this stretch also puts a pressure on the RBC wall and actually can damage the RBC membrane. And as you know, if RBCs are damaged by any mechanism, doesn't matter which mechanism they are damaged, they will be always be dumped on the spleen. So spleen is the dumping ground for RBCs, and whenever the RBCs are being dumped, they will release a lot of bilirubin, as you know, and sometimes this bilirubin may not be handled well by liver, leading to unconjugated hyperbilirubinemia, or also you can call it jaundice. So jaundice can also be present in a patient with sickle cell anemia like this. So this patient, you can see jaundice. So jaundice can be present. Okay, but here is another thing that you can see, autosplenectomy. So let me explain the why that autosplenectomy occurred. So you see that I have already mentioned that spleen is the dumping ground. So whenever you are dumping something like RBCs in spleen, first of all, it gets bigger. But there is a problem. The RBCs that are sickled, they actually also block the vessels that supply the spleen. And periodically, the periodic blockage of the splenic vessels actually causes some microinfarcts and some damages. And as the child grows up, their spleen gets actually smaller, and ultimately the spleen gets so shrunken that it can do its function. And the main function of the spleen is actually the macrophage, splenic macrophage is actually phagocytose the encapsulated organisms like Streptococcus pneumoniae, Haemophilus influenzae, Neisseria meningitidis. So in a patient with sickle cell anemia for a longer time who has a very small spleen due to repeated infections will have more susceptibility to have those kind of infections. So we need to vaccinate them with the vaccines. So streptococcal vaccines and Haemophilus vaccine and Neisseria meningitis vaccine. So those are the most important things that you have to know on pathology about sickle cell anemia. But there are some other things that you can know. You can remember that they are more common in African American patient. It is autosomal recessive. Okay, it is autosomal recessive, and you can use hydroxyurea to improve the patient's hemoglobin F, which will reduce the symptoms. And those are the most important things. And one thing you can also remember, that if a patient with sickle cell anemia gets an infection with parvovirus, they can have an aplastic crisis, which is very devastating. Okay, so those should be all from me about sickle cell anemia. There are some other things that you might want to know, but I think those are the things, the basics, and I've tried to touch them all. Thanks all for watching my video.